More than 400,000 cases recorded globally, over 18,000 deaths in at least 180 countries. That is the reality of the coronavirus, and we have to take it seriously. So what can we do to better battle this virus? Well, a lot of the responsibility lies on you and me. I am Eddy Micah Jr., and you're welcome to a special edition of the 77%. Now, according to the World Health Organization, the coronavirus is mainly spreading through droplets of saliva or discharge from the nose, also easily being transferred from one infected person to the other. And that's a problem. You keep touching, you keep spreading it. Now, picture this for a second. The African continent has about 54 countries. Out of these 54, at least 41 countries have reported cases of the coronavirus, and the number could increase. So what can we do as a people to best tackle the coronavirus?
I used to wash my hands maybe once I'm about to eat, but this time around, within 3 to 5 minutes, I want to look for the next available running water with soap. So just to run away from the virus and stay safe with my family.
My kids are, now we cannot shake hands. Greetings, it's a matter of hitting the legs. There is a style that we're using, and then the hands like the elbow. We are not using our hands anymore.
After touching my keyboard, I have to make sure I put a little in my hand and then just rub it, and I feel that I'm safe. All germs are dead now. Any virus is gone.
With the coronavirus, I think people will use more of their mobile phone these days to do these things, even after the virus has gone. It's so conducive. I didn't have to go and brush my teeth. I didn't have to get dressed. I was in my panties when I was in the presence of God in church. So that's what I do to avoid social contact.
We have to take it seriously. If not for you, think about all the people around you. Why? Because the World Health Organization says that older people and people with pre-existing medical conditions are the most at risk. So we're talking about people with conditions like diabetes, cancer, respiratory conditions. They will end up having even more serious illness and could die from this. And I'm sure you don't want to be the person responsible for someone's death. So what can we do? First of all, don't panic, but definitely don't listen to fake news. Because number one, we Black Africans are not immune to the virus. You've seen the cases across Africa. I don't need to say much. Two, hotter climate or hot temperatures when the sun is up is not gonna kill the virus. And it doesn't mean you can still not get infected and pass it on to another. So sun is good, but it's not killing the virus. Thirdly, the coronavirus cannot be spread through mosquito bites. So if you've heard that news going around, forget about that. Don't panic. So what more can we do? Now, I, for instance, try to keep a 2-meter distance between me and the other person that I'm talking to. Like this. Thanks, Eddy. Now also, I'm not judging all you smokers out there. We love you, so we have to pass this on, because the more you smoke, the more weaker your lungs are to deal with some of the effects of this coronavirus. So maybe try to put a stop to it if you can, for your own good and for the good of the people around you. Now, talking about smoking, Smokey is a hip-hop artist in Burkina Faso, and he's got some ideas and some advice to share with us on how best we can all contribute to tackling coronavirus.
First of all, wash your hands thoroughly and frequently with a hydroalcoholic solution. This should be done for at least 30 seconds. And since this virus is a real pest, avoid touching your eyes, nose, ears, and mouth because the virus can enter the body through this simple contact. Avoid also going to centers where there are people of fragile health, such as hospitals, maternity wards, and retirement homes. Use a tissue that must be immediately thrown away, and if you don't have a tissue, you should use the fold of your elbow. You have to avoid big gatherings, avoid unnecessary greetings, hey bro, snap finger. And if you do not feel well, you have a fever, cough, and respiratory problems, stay at home. Call a doctor, consult him, and strictly follow the instructions of the health authorities. Boys who like to share kisses with girls, sorry, with coronavirus, you have got to take it slow. The threat is real.
Thanks a lot, Smokey. You couldn't have said it better. The threat is indeed real. See, also because there's no vaccine or treatment for the coronavirus disease. So really, if you have it, then you are more or less on an island of your own. Symptoms include fever, some slight headaches, some pains and aches, sneezing, coughing. These are just to mention a few of the symptoms. The other thing is, even if you don't have these symptoms, you still could have the virus. It's just the symptoms are not showing yet. Act like you already have the disease, and this makes you extra conscious and alert to watch out so you don't spread it to other people. I'm hoping that instead of spreading the coronavirus, we rather spread the word about it. You can spread it all out to your friends and loved ones by sharing this particular edition of the 77%. And the comment section below, just tell us also, we want to know, how is your government handling the coronavirus epidemic? Are you satisfied with it? I'm hoping the next edition of the 77 will be us talking about how we all came together as a people to fight the virus. Yeah? I'm sure you're with me on that one. So fingers crossed, stay safe, quarantine yourself, and let's stay healthy.